hepatitis B surface antigen, HBsAg, and confirmation. The hepatitis B is a viral infection that primarily affects the liver, responsible for millions of infections worldwide and a leading cause of chronic liver disease, cirrhosis, and liver cancer. Detecting and monitoring hepatitis B infection has become a cornerstone of global health programs aimed at reducing its prevalence, and one of the most critical tools in this effort is the hepatitis B surface antigen test. Hepatitis B surface antigen is a key marker for determining whether an active hepatitis B infection is present. This antigen is a protein on the outer surface of the hepatitis B virus. The presence of hepatitis B surface antigen in a patient's blood indicates that the virus is actively replicating, making hepatitis B surface antigen one of the earliest detectable signs of infection during the acute or chronic stages of the disease. Detecting hepatitis B surface antigen is detectable 2 to 6 weeks after infection, and testing for hepatitis B surface antigen is essential for diagnosing both acute and chronic HBV infection. The importance of this antigen is that it not only reveals the presence of an active infection, but also assesses whether an individual is likely to transmit it to others. Because HBV is transmitted through contact with infected body fluids, such as blood, semen, and vaginal secretions, identifying hepatitis B surface antigen positive individuals is critical to controlling the spread of the virus. Once the virus enters the body, the immune system works to eliminate the infection by producing antibodies. In many cases, especially chronic HBV infection, the virus manages to evade the immune system, continuing to replicate and causing long-term liver damage. The detection of hepatitis B surface antigen indicates that an individual has an active infection, and further diagnostic steps are needed to determine the severity and progression of the disease. Hepatitis B surface antigen testing. Hepatitis B surface antigen testing is often performed as part of routine hepatitis B screening. This screening is recommended for a number of reasons, including high-risk groups, people who are at increased risk for HBV infection, such as healthcare workers, intravenous drug users, or people who have multiple sexual partners. Pregnant women. Screening is often part of prenatal care to prevent mother-to-child transmission during delivery. Immigrants or travelers from endemic areas. HBV infection rates are higher in certain areas of the world, so screening people in these areas is important. People with liver disease. People who have signs of liver dysfunction may be tested to see if HBV is the underlying cause. The hepatitis B surface antigen test is a blood test. A small sample of blood is drawn from a vein and sent to a laboratory to test for the presence of the surface antigen. Negative hepatitis B surface antigen test result. A negative result means that the hepatitis B surface antigen is not detected in the blood. This usually indicates that the person is not currently infected with the HBV virus. However, a negative result does not necessarily mean that the person has never been exposed to the virus. Other tests, such as anti-HBc and anti-HBs, may be needed to provide a complete picture of a person's HBV status. For example, a person who has been vaccinated against hepatitis B may test negative for hepatitis B surface antigen but positive for anti-HBs, indicating immunity from the vaccine. A person who has cleared a past infection with the HBV virus will also have a negative hepatitis B surface antigen result, but they may have both anti-HBc and anti-HBs antibodies, indicating that they have recovered from the virus and are now immune. Positive hepatitis B surface antigen test result. A positive result indicates the presence of HBV in the blood. This means that the patient either has an acute infection, if the infection is new, or a chronic infection, if the infection has lasted for more than 6 months. Because hepatitis B surface antigen is often the first marker to appear after infection, a positive result is a strong indicator that the virus is actively replicating. Further testing is often needed to differentiate between acute and chronic infections. For example, in acute infection, patients may experience symptoms such as jaundice, fatigue, and abdominal pain, and hepatitis B surface antigen is detected early after the patient is exposed to the virus. In chronic infection, hepatitis B surface antigen persists in the blood for more than 6 months, and patients may be asymptomatic but still have ongoing liver inflammation, which can lead to long-term complications such as cirrhosis or liver cancer. When hepatitis B surface antigen is detected, doctors often order additional tests to evaluate liver function, viral load, and other markers of immune response. These include hepatitis B surface antigen, a marker for high levels of viral replication; hepatitis B virus DNA, a measurement of the actual amount of virus in the blood, which is used to assess the severity of infection in response to treatment. When a hepatitis B test result is labeled as reactive, it means that the test detects the presence of a specific marker, such as an antigen or antibody, in the blood. In hepatitis B testing, a reactive result indicates a positive result, indicating exposure to the hepatitis B virus or the presence of an infection. Here are what the reactivity of different hepatitis B markers means. Hepatitis B surface antigen reactive. What it means: a reactive hepatitis B surface antigen result indicates the current presence of HBV in the blood, meaning that the person is infected. This may be an acute, recent infection or a chronic, long-term infection. Significance: the individual may be contagious and able to spread the virus to others. Next steps: further testing may be needed to determine if the infection is acute or chronic. Monitoring and possible treatment will depend on the status of the infection. Hepatitis B surface antigen confirmatory test. A positive hepatitis B surface antigen result is often followed by a confirmatory test. This test is done to rule out any false positives that may occur due to technical or biological factors. This is especially true in settings with a lower prevalence of HBV, as the likelihood of a false positive result may be higher in these populations. Confirmatory testing may involve repeating the hepatitis B surface antigen test or using an alternative test with greater specificity. Importance of hepatitis B surface antigen testing in public health. Screening for hepatitis B surface antigen allows healthcare providers to identify infected individuals and provide them with appropriate counseling, treatment, and monitoring to prevent disease progression. Take steps to reduce the risk of transmission to others, especially in high-risk settings such as healthcare facilities or homes. Ensure that newborns of hepatitis B surface antigen positive mothers receive appropriate preventive care, including hepatitis B immune globulin and hepatitis B vaccine, to prevent perinatal transmission. Hepatitis B surface antigen and chronic hepatitis B. Chronic hepatitis B is a serious disease that affects millions of people worldwide. While some people with chronic hepatitis B may be asymptomatic for many years, the virus can cause severe liver damage over time. Chronic hepatitis B surface antigen carriers are at higher risk for complications such as fibrosis. Scar tissue builds up in the liver due to chronic inflammation. Cirrhosis. A severe form of fibrosis where the liver structure is permanently damaged, resulting in impaired liver function. Hepatocellular carcinoma. A type of liver cancer that usually develops in people with chronic hepatitis B infection, especially those with cirrhosis.